The William R. Bliss Cancer Center, a partnership between McFarland Clinic and Mary Greeley Medical Center in Ames, Iowa, created a unique program known as the Nurse Navigator program to provide coordinated care for patients with breast cancer. Mary Ellen Carreno, who is in charge of the program and acts as a nurse navigator for patients, discusses how the program got its start and how it works at McFarland Clinic.
The Nurse Navigator program is a program that identifies patients newly diagnosed with cancer, and particularly right now we're working with breast cancer patients. So what we do is we meet with patients right after their initial diagnosis of breast cancer, and then we help them get good information and resources to make decisions regarding their care. And we also anticipate other needs that they might have in relationship to the inconvenience that their disease has on their life. My role is to coordinate the Nurse Navigator program. And so initially at this point, I work as a navigator directly with patients. We're looking not only at the physical aspect of dealing with the diagnosis, but also the social emotional part of dealing with the diagnosis. The navigator's key role in that process is assessing what the patient's needs are, and then brainstorming, implementing resources for the patients to deal with the other circumstances of a newly diagnosed cancer.
McFarland Clinic physicians and the Nurse Navigator work together to assess each patient's medical, emotional, and physical needs during the treatment process. Dr. Partridge, McFarland Clinic surgeon, and Dr. Pro, a member of the clinic's oncology team, discuss their roles in the program.
The role of the medical oncologist, which is my role, I'm the person who lays out the roadmap of how you get from the time of diagnosis through your treatment plan and for follow-up long-term.
My role in the program is to inform the Nurse Navigator of the patient's problem, give her any insight that I've felt as their surgeon on giving them advice as far as places I think they need help. The Nurse Navigator, you know, they have one role, and that's to help the patient and to make them feel more comfortable with what's going on. That's my role too, but I also have a role of removing the cancer from the patient. And it's not that that distracts me from taking care of them, but it's nice to have that one person that hopefully they connect with on an emotional level, that they can, you know, on a bad day they can break down with them, on a good day they can celebrate and hug with them, you know, and all those things that we like to do too, but this is just one more person.
To learn more about the Nurse Navigator program, go online to McFarlandClinic.com or contact the William R. Bliss Cancer Center at 515-239-4401.